Welcome back. In this video, we'll engage in some practical case-based projects where we'll create a treatment plan for a patient with moderate to severe depression, incorporating both pharmacological and psychosocial interventions. We'll also design a personalized cognitive behavioral therapy, CBT session, for a person struggling with both depression and anxiety. These hands-on exercises are essential in applying what we've learned in previous lessons to real-world scenarios. Let's start by creating a treatment plan for a patient with moderate to severe depression. Imagine you're working with a 30-year-old patient, Sarah, who has been experiencing depression for the past 6 months. Her symptoms include persistent sadness, loss of interest in activities, fatigue, sleep disturbances, low energy, and feelings of worthlessness. She has difficulty performing daily tasks, like going to work, taking care of personal hygiene, and interacting with family and friends. She also reports occasional thoughts of death, though she has not made any suicide attempts. Step 1. Pharmacological intervention. Given the severity of Sarah's depression, she would likely benefit from pharmacological treatment. Since she has moderate to severe depression, antidepressants will be the foundation of her treatment. A selective serotonin reuptake inhibitor, SSRI, such as sertraline, Zoloft, would be a good first option. SSRIs are well tolerated and have a favorable side effect profile. Sarah's doctor would start her on a low dose to minimize side effects and gradually increase the dose to achieve the desired therapeutic effect. It's important to monitor Sarah's symptom progression and any potential side effects such as nausea, sexual dysfunction, or insomnia, which could impact her adherence to the medication. Step 2. Psychosocial intervention, cognitive behavioral therapy, CBT. In addition to medication, cognitive behavioral therapy, CBT, would be an essential part of Sarah's treatment plan. CBT focuses on identifying and challenging negative thought patterns that contribute to depression, and it helps patients develop healthier coping mechanisms. In Sarah's case, her negative self-talk and feelings of worthlessness are significant contributors to her depression. During CBT sessions, she would work with her therapist to identify thoughts like, "I'm not good enough," or "I'll never get better," and replace them with more realistic, balanced thoughts. Sarah would also learn problem-solving skills and stress management techniques to help her manage everyday stressors that might exacerbate her depression. Step 3. Adjunct therapies. Along with CBT, behavioral activation would be important in Sarah's treatment. This involves helping her re-engage with activities that she once enjoyed but has stopped doing because of her depression. She could start small, maybe a short walk in the morning, spending time with family, or pursuing a hobby she used to enjoy. Behavioral activation helps break the cycle of inactivity and withdrawal, which are common in depression. Step 4. Monitoring and follow-up. Finally, Sarah's treatment plan would include regular follow-up appointments to monitor her progress, assess for any side effects, and adjust her treatment plan as needed. If her symptoms don't improve after several weeks, the clinician might consider adjusting her medication or adding another therapeutic approach, such as interpersonal therapy, IPT, or family therapy, especially if interpersonal issues are contributing to her depression. Reflection questions. Why is it important to combine both pharmacological and psychosocial interventions when treating moderate to severe depression? How can behavioral activation help someone like Sarah re-engage with life and break the cycle of depression? Next, let's design a personalized CBT session for a person struggling with both depression and anxiety. Now imagine we're working with John, a 40-year-old man who has been dealing with both depression and generalized anxiety disorder, GAD. John reports constant worry about his job, relationships, and future. He also feels disconnected from his work and struggles with lack of motivation. Step 1. Identify negative thought patterns. In the first step of a CBT session, we would begin by identifying John's negative thought patterns. John's constant anxiety often leads to overwhelming thoughts like, "I'm going to lose my job," or "things will never improve." These thoughts reinforce his feelings of sadness and hopelessness. John's therapist would guide him to recognize these cognitive distortions, such as catastrophizing, expecting the worst possible outcome, and all or nothing thinking, believing things are either perfect or a total failure. The goal is to help John challenge these thoughts and replace them with more balanced, rational ones. Step 2. Behavioral activation. Next, we would incorporate behavioral activation into John's session. Anxiety and depression often make people withdraw from activities and social interactions. For John, this means he might avoid things that would usually bring him joy or fulfillment, like going out with friends or pursuing hobbies. The therapist would help John start by setting small, achievable goals. For example, he could begin with a simple task like taking a 10-minute walk or making a phone call to a friend. Gradually, these activities would become a way for John to feel a sense of accomplishment and reconnect with life, reducing both his depression and anxiety. Step 3. Anxiety management techniques. In a personalized CBT session for anxiety and depression, we would also include relaxation exercises and anxiety management techniques. This might include deep breathing, mindfulness, or progressive muscle relaxation. These techniques help John manage his physical symptoms of anxiety, like tight muscles and shallow breathing, which in turn can reduce his overall emotional distress. Step 4. Addressing core issues. John's therapist might also explore any core beliefs that are contributing to both his depression and anxiety. For example, John might have an underlying belief like, "I'm not good enough," or "I must always succeed." These beliefs often drive both anxiety, fear of failure, and depression, feeling inadequate. Over time, John would work with his therapist to reframe these beliefs and develop healthier, more realistic perspectives. Reflection questions. How do you think identifying and challenging negative thought patterns can help someone struggling with both anxiety and depression? Why is behavioral activation important for someone who is withdrawing from life due to both anxiety and depression? In summary, treating depression, especially when it coexists with anxiety, requires a multifaceted approach that includes pharmacological treatments, psychosocial interventions, and behavioral techniques. By combining approaches like CBT, behavioral activation, and relaxation exercises, therapists can help individuals like Sarah and John regain control over their thoughts, feelings, and behaviors, leading to a better quality of life. In the next video, we'll explore the role of problem-solving therapy exercises and role-playing scenarios in applying these treatment methods to real-world situations. Let's keep it going, and I'll see you in the next one.